The kids, when it comes to, anal sex and bottoming, folks don't care about, STIs and HIV and some other stuff. They care about if they're going to paint the walls or if, so they're going to give somebody a dirty deal.
We're very socially conservative around sex. How do you think we can start to expand the conversation and be really honest?
But when we talk about sex, we should be talking about sexual health and we should be talking about pleasure. I think one of the things that people don't talk about enough is that sex, most of the reasons why we have sex is so we can get a nut. People forget, and the CDC puts out these like 5 P's of a sexual history. And one of the P's they always forget to talk about is pleasure. And so I think if we start our conversations and start changing the conversations into how do we talk about sex as pleasure and destigmatizing if someone's mode of pleasure or what they're attracted to or what they like to do is different than yours, just talk about pleasure and how to maintain health, then we can kind of open the doorways to talking about STIs and HIV prevention and all that other stuff. But if you just pound people over the head with, well, if you stick your dick in that hole without a condom, if you let somebody nut up in you, then you're going to get an STI. So you're at risk, you're at risk, you're at risk. Black gay men, we've been here, we're at risk for everything for the past 30 fucking years. So it's about time that we start talking about what's good in our lives, what's pleasurable in our lives, what we enjoy doing, and how we get off without any stigma or judgment. That's where we need to start. And we need to start with the church folks, because there's a lot of us in the church.
There's a lot of medical mistrust. We don't trust doctors. I trust asking you this question because a large part of your career has been dedicated to dealing with racial inequities in the medical, in the medical field and things like that, and addressing concerns that we have as a Black community. What do you think that the medical professionals can do to ease and eliminate the medical mistrust that exists?
I mean, they can stop being so racist. That could be one part. That's a first step. I think the second step is kind of looking inward. People in the medical profession looking at themselves rather than asking people, why does the Black community distrust us? The other question, the flip side of that question is, what could we be doing better to earn the trust of Black communities? And so they don't ask themselves that question. And I'll give you a quick example, because I think examples are always good. I had a mentee of mine, a very dear friend, who was having diarrhea like 4 or 5 days in a row and just going to the bathroom all the time. And he thought it was food poisoning. He was nauseated, vomiting, this, that, and the other. Went to a doctor, also living with HIV, on his meds, undetectable, doing well. Went to see his own, someone who was at his clinic, but it wasn't his regular doctor, but another HIV expert nonetheless, and was telling the person what was going on, and then told the physician, I eat ass too. And he had just been eating some ass a few days before, which when you're eating ass, you think about things like hepatitis A, you think about entamoeba, which is an infectious agent that people can get. You think about a parasite called Giardia. It's not your typical, oh, this is food poisoning. He had some bad Chinese food or fried rice or some uncooked chicken, and now he's a little bit sick. So, we'll usually do stool cultures. We'll do some other stuff. I'm not saying to give them antibiotics or antiparasitics at the time, but what he had to do, he had to fight like in the room to say, hey, do you think you want to get a stool culture? Because it's been about 4 to 5 days. Usually, if it's just a simple food poisoning, it lasts maybe 3 to 5 days at most. And then you have to start looking for other stuff. But the fact that he actually had to convince her or cajole her to say, hey, I need you to do your job and do these extra things is painful. That's why we don't distrust a lot of medical professionals, because they tend to do the bare minimum when it comes to us than when it comes to someone that looks like them who comes in with blonde hair and blue eyes. So we have every right to be distrustful of the medical profession. It's not something that we say, well, you know what, Tuskegee was in the past, and that ended in 1972, so da-da-da-da. Racism still goes on in the medical profession today, and there's abundant literature to document that. So what we have to do is stop saying, oh, that was in the past, and instead the medical profession needs to shut up, sit down, be humble, and just say, okay, what are we doing wrong, or what has your experience been? And then how can I improve it? Be solutions-based. Don't get defensive. Well, I do that with all my patients. Well, I do that with this. Well, I'm not racist. Well, I have a Black wife. Don't do any of that. Just shut up and listen and figure out what you can do with solutions and work with us as patients together. I think that needs to happen. And then also on the flip side, so the medical profession needs to do a lot, but also we need to empower ourselves with the knowledge and the information that when we do meet that racist or lazy or apathetic medical professional that's sitting in front of us and will not do their job, that we have the knowledge and we can pull out an app with the CDC recommendations and say, oh, you're supposed to be testing me for this. Oh, you're supposed to be doing this. Oh, did you think about maybe doing this because of the symptoms that I have? If we call them to the task and let them know that we are just as intelligent and just as well-versed as they are, they'll all of a sudden perk up and be like, oh, I guess I need to actually do my full job now. And so I think the medical profession has a lot of work to do, but in the meantime, while they're getting their act together, we can actually do things to kind of push the agenda, which is exactly what my mentee did the other day. He kind of forced her to do that. And so he's waiting on some of those culture results right now. But it's one of those things where, you know, we're put in this position where we have to tell people how to do their job, which shouldn't be the case.
Your friend, I mean, who ate the bad ass. That's why you got to be careful when you get it. I buy my ass from Whole Foods, okay? Oh my goodness. One last really important question: where should Black people and the Black gay men look for resources, medical resources?
You know, there are people that I trust on Twitter. I would say there's more individuals that I trust. Like I trust the Blackstock twins, Uche and Oni Blackstock, and they really do a lot of work with health equities. And I follow them kind of religiously. There's blackdoctors.org, I believe, is a website as well. But it depends, particularly for Black LGBTQ folks. And one of the things that I would want to shout out is when we consider health just in general, prioritizing mental health. And I think Yolo Akili with his BEAM organization is actually a really good example of something that's grown up for us that doesn't just focus on LGBTQ folks, it focuses on the Black community in general. Remember that it's not just our physical health, but it's also our emotional and mental health as well.